Hi, I'm Dr. Cucin. I'm a board-certified plastic surgeon who trained at Cornell in both my general and plastic residencies. I've been practicing about 38 years, and I've been at the center here for about 3 years. I love to do noses. It's one of my favorite procedures. It can dramatically improve a patient's appearance. One thing that it's very easy to correct, and it has a massive impact on somebody's social life. There are basically 4 parts to a nose. 2 sets of cartilages, 2 sets of bones, and a septum. And you do a little bit of each of those for every different patient, a little bit degree on each one, a little bit different proportion, but those are the basic 4 areas. The hump generally is bony, but there's always a little bit contribution from the septum, and the width is mainly from the cartilages at the bottom and the mid portion of the nose. The length and the droopiness is generally from the bottom part of the septum, so that's why we do all parts. And of course, if there's a breathing problem, we try to get the septum to be straighter than it was and not obstruct the airway. It's a pretty quick procedure for patients to recoup from. The cast stays on for 7 days. There's not a whole lot of pain or discomfort. When the cast comes off, you pretty much have the profile you're going to have, and you have the length you're going to have. So the tip of the nose will generally be a little bit wider. The younger you are, the longer the swelling will persist, but I usually give a general rule of 80% of the swelling is down by 8 months. If you're younger, it tends to last a little bit longer. If you're older, it's a little bit faster. When you have raging adolescent hormones, the body just heals more exuberantly, so it tends to take a little bit longer. The post-op period is pretty easy. I mean, for 1 week, I let the patients do basically bicycle, treadmill, walking, and sex. And then 2 weeks after that, they can return to the gym and do things where they raise their blood pressure a little bit during those 2 weeks. Immediately after surgery, I like the patient to stay out of water. I mean, they can get into the pool, but not go underneath the water, because pools are not really terribly sterile in spite of the chlorine. In terms of general follow-ups, I always like the patient to come back at 1 week because I like to take the cast off myself, and if we've done anything to narrow the nostrils, which is called an alarplasty or weir resections, as we generally do on ethnic noses, those sutures come out also at 7 days. I'll generally see the patient at 3 to 4 weeks after that. If they're not local, it'll be a FaceTime. And then generally speaking, 3 months, 6 months, 9 months in a year as kind of a routine. If there's particular swelling, I may give some steroid injections to this area of the nose because this is where the cuts are made on the inside. And by the way, I do almost entirely closed rhinoplasties. I very seldom have to do an open rhinoplasty, particularly on a primary. Open rhinoplasties are generally for difficult revisions, and I do them pretty sparingly because unless somebody has exceedingly tiny nostrils, you can really get all the exposure you need. Secondary rhinoplasties, kind of redoing things when they went amok the first time. Me personally, I have fairly low revision rate, something like maybe 1 or 2 in 100, where I take a little bit more off the hump because I'm very conservative. You can always take off, it's not that easy to put back. But the secondary rhinoplasty generally involves that putting back, and that's usually take a graft from either the septum, the center part of the septum, or the patient's ear, and you put it either on top or at the tip as you have to. The pre and post-op on the secondaries are pretty much the same. The cast stays on for a week. The dressing will stay on the ear for a week. I might leave the packing in the nose. I generally leave a packing just overnight on routine rhinoplasties. If I've done harvested a septal graft to put on top for some structure, I may leave the packing in an extra day or 2. Other than that, it's pretty much the same post-operative care for secondary rhinoplasty as a primary rhinoplasty. Patient will see the result immediately when the cast comes off, so far as the hump, so far as the length, so far as the width of the bony part of the nose. They'll also see immediately what they're going to get finally with the tip of the nose, but the tip of the nose will swell up, and that swelling will persist, and as I said, the longer, the younger the patient. But as a general rule, 80% of the swelling is down by 8 months, but the nose will continue to refine and contour for up to 2 years after surgery. To prep for a rhinoplasty, the patients don't have to do much. If they want to be nice to us, they can trim the hairs inside the nostrils, and they can remove all of the jewelry if they have any piercings, septal or alar. And as we speak about piercings, I always tell the patients the outside holes stay open, the inside holes are closed. I hope they'll like their nose enough that they're not going to stick any jewelry in it, but if they do, they can go through the exact same holes as they used before, but they will be re-piercing on the inside part of those holes. Certain procedures are quite common to couple with a rhinoplasty and do at the same time because they're basically on the head and neck in the same area. Chin implant, if somebody has a receding chin or a soft chin, that's a very common combination. Alarplasty, which I mentioned before, to refine the nostrils, is another common combination. Somebody needs their eyelids done. That too is a common procedure, both upper and lower lids for extra skin or fat. And otoplasty if the ears are prominent. And submental liposuction to improve the jawline. And sometimes in combination you do both a chin implant and a submental liposuction to improve the jawline. Because the profile is the forehead, the nose, and the chin. And if you give the bottom part more definition with the chin implant or with a submental liposuction, if somebody has a little fat there, that will improve the overall impression of the face and the profile. Well, septoplasty is more for patients who are having functional defects as opposed to a cosmetic defect. There you're working on the airway. And when you're doing a cosmetic rhinoplasty, you can't do an aggressive septoplasty in the central part of the nose because that's the strut that supports the two bones when you're going to break the bones. But you can do the top part and the bottom part, and that's usually the part that's crooked, at least visibly crooked. So what I will do at the same time, if there's an airway problem, I would fracture the inferior turbinates. When you're doing a cosmetic rhinoplasty, you cannot aggressively manipulate the center part of the septum. You can fracture it, you can move it over, but you generally won't do what's called a submucous resection of the septum if you're going to break the bones because you want that central support. What I will do is take the top and bottom parts out because those are usually the crooked parts. The bottom part sometimes interferes with the airway, and I'll outfracture the inferior turbinates. There are three shells which humidify the air, and the bottom one is the biggest and the largest and the most frequently affected with allergies. And if you outfracture that, you improve the airway fairly substantially. So that I will almost uniformly do on any functional obstruction case. And my very last step, 100% of the time, is to suction out the patient's nasopharynx, and I put a 16 French catheter through the nostril, and if it doesn't pass easily into the throat, I routinely outfracture the inferior turbinates to give a better airway, because I want my patients to be able to breathe post-operatively, obviously, even if they didn't complain about it as a problem. If I notice it, I treat it. Post-operatively, the patient should try to avoid the sun because it increases swelling, and you certainly don't want a sunburn on a fresh surgery area, but the worst thing is that it increases the swelling, so the patient to use sunblock and a wide-brimmed hat, because even just the heat, like a sauna, increases swelling, and it's a good idea to avoid for the first 3 to 6 weeks. And the patient should avoid smoking or vaping because the nicotine constricts the blood vessels and interferes with healing. For the first 2 weeks, I like the patient not to do anything which raises the blood pressure a whole lot so they don't have a nosebleed. I like them to avoid the gym and swimming underwater for 3 weeks. And certainly contact sports, if they're on the wrestling team or something like that, I like them to avoid for at least 6 weeks. If you'd like to know if you're a candidate for rhinoplasty, give us a call to schedule your free consultation. If you found this video helpful, tap like, add a comment, and subscribe. We're here to help you feel confident both before and after surgery.